All right, thank you. We're over here chit-chatting as women do. Today we are combating aging. Now, it's something many women worry about, obviously. But how do you attack the problem? Well, that depends on what phase of life you're in. So what I need to do might be different from what Dr. Purvisha Patel would do, because we're different age groups, and we have the 20s, the 30s, the 40s, and the 50s, the Ys down there. I really need to go down there with Christy. Welcome so much. Okay, so let's talk for a minute about the 20s. What does Kelly need to do now to make sure that, you know, she represents the 50s and 60s well?
Sure. Kelly's beautiful, as you can see, and now really it's really essential to start wearing a powerful sunscreen in the morning with a 30+ SPF, and also in the evening washing your face as regular as possible. So washing twice a day is important.
And that's a problem, isn't it? A lot of people, particularly when you're your age, I know I did it, oh, I'm so tired, it won't hurt. Because it doesn't hurt once. But over time, what does it do?
Well, over time, you want to wash the debris off the face, but you also want to exfoliate the skin. You want to get those dead skin cells off the surface of the skin, so that boosts the new cells to come to the surface, and that increases collagen production. We're in the 20s. We're still kind of sometimes coming out of the time period where we're still making a little bit of acne or spots, and we want to exfoliate the skin and open those pores up so we don't make any more as well.
Okay. What about the 30s? Here we have beautiful and gorgeous Kim.
Kim has wonderful skin. Right about now, in the 30s, we want to add a retinol into the nighttime regimen.
What does that do?
So a retinol is an over-the-counter vitamin A cream that will increase cell turnover very gently. And as we start to do that, increase the strength as we get older, that will actually boost collagen and help in the overall with fine lines and wrinkles.
So as we age, your skin cells turn over less frequently, is that correct?
As we age, we lose collagen, and the sun damages the DNA in the cells, so we want to turn those damaged cells over faster.
Oh, okay. And when you mention sunscreen, I've always heard layering sunscreen, like using a moisturizer with some sunscreen, then using a foundation or a powder with sunscreen, yes or no?
The numbers are not cumulative.
Oh.
So putting on a 15 moisturizer and then putting on a 15 base does not make it a 30 SPF.
It doesn't.
No. So
good to know.
It's good to use. There's new creams out there on the market. They're called BB creams or CC creams. We blog about them at Advanced Dermatology, Memphis.com on our website. And using those in the morning would incorporate a moisturizer, a sunscreen, and a tint.
And that gives you that 30 that you need?
Some do.
All right, let's move to Christine, who's in her early 40s. What starts happening as you're 40 besides the skin cells again, you know, further damage to the collagen? You want to turn it over faster. What else can you do?
What we're noticing now in the 40s is sun damage is starting to show through. And so the sequela of not using, being as regular about using a sunscreen on a daily basis can show. And also, if we start using a retinol in our 30s and in our 40s, we exfoliate those sunspots off a little bit more as well, so that's also helpful. At this point, adding a prescription retin-A or tretinoin into your regimen would be very helpful, and we can also use bleaching creams and lightening agents, both natural and synthetic, to lighten up the sunspots. There's laser procedures and chemical peels that can be done as well.
Okay, and then for folks like Christy and I, who were, as children, we didn't have sunscreen. Nobody sent us out with sunscreen, so we're really in trouble.
Well, I wouldn't say trouble, but we can always work on what we've got now and try to build our skin a little bit more. So the ultraviolet radiation damages the cells increase in pigmentation, and they also can change, and you can start to get skin cancer at this age. Okay, and so this is really important to make sure that throughout the ages you get regular skin exams, at least every year, or if you have a family history of skin cancer, at least every 6 months.
Whole body?
Whole body. And again, I think that's very important. And Christy, as we're seeing, she's beautiful.
She is.
As time progresses, we not only lose collagen, but we're losing a little bit of facial volume there. And this is when people start using products with retin-A and sunscreen, and then also start using fillers. Fillers or injections or things that we use under the skin to give you back that facial volume.
What is that you're injecting in there?
Fillers come in 5 flavors, actually. So there's 5 different types of fillers. The first type of filler is hyaluronic acid. That active ingredient is water. That's a water-binding molecule. Those products are Juvederm, Restylane, Perlane, Bellaterra, Hydrel. Those last 6 to 8 months. The second type of
Okay,
filler.
we won't have time for all five, but
we can
basically,
look
are
at
they
our
natural,
website.
that break down naturally in the skin?
The majority of them.
Okay, cool. Ask the doctor. And Dr. Patel will open a new facility in DeSoto County
That's correct.
in April. We'll be right back.